understand. It generally takes about 8 or 10 minutes for the gastroenterologist to perform this procedure. They negotiate the scope around the colon, which is often very difficult.
Yeah.
They spend a good part of their effort, not so much looking, but negotiating this instrument. And then they look on the way out, because that's the only way they really can look.
Yeah.
So they get really one shot at it. When we do a virtual colonoscopy, on every colon, I get to look at the colon at least 6 times. I can look at it 10 times, 20 times, but never less than 6 times. Well, even if you're not that bright, if you get to look at something 6 times, you're going to have a little more accuracy. So there are certain advantages, which is why...
But how do you know you're seeing the real... If it's virtual, how
well, it's not... Yeah, I'm sorry, go ahead.
No, I don't understand how you could really be seeing the inside of the colon.
Okay, I'll explain it to you. A CT scan, have you ever had any kind of CT scan? Okay. A CT scan takes multiple very thin slices. So that's not virtual at all. That's quite real. That's taking cross-sectional images of very, very thin slices of whatever organ you're looking at. And we look at those images, but the computer also then generates a 3-dimensional rendering of that. So it's not fictionalized. Plus the software is so clever, it actually knows what you've looked at. So after I've gone through this colon, it will show me, by pressing a button, the areas, in this case they light up green, that I haven't seen. So it can actually direct me to the areas that I haven't seen to make sure I see them.
Does it also call attention to what may be abnormalities or problem areas?
It's a very good question. There's something...
I ask a lot of good questions.
Yeah, well, that's why you have this job.
Yeah, no.
There are technologies available now that are not FDA approved in this country, although I use it because I do some research with one of the companies, called computer-aided detection. A computer basically scans the colon and says, look at this, look at this, look at this, and then I decide whether or not it's something real or not.
Yeah, I can see where that would be one of the simpler aspects.
It's very helpful.
And along the same point, a virtual colonoscopy finds what are called extracolonic findings as well. It can find aortas, correct?
Oh yes, it can find many things.
It can find kidney cancer, pancreatic cancer. It can find, and we know people in our organization that went in for a virtual colonoscopy and they found other forms of cancer that were caught at an early stage and were treatable. So there are some side benefits to the virtual colonoscopy that you only get from that test.
I can understand why people who smoke get lung cancer. Why do so many people get colon cancer?
Nobody knows. They think it's related to diet. They think it's related to obesity. But they really don't know what causes colon cancer. Smoking certainly contributes to it. But that's what's scary about this disease.
But if you don't smoke and you're not overweight.
And we have lots of thin vegetarians at the Colon Cancer Alliance who have colon cancer. We have people in their 20s and 30s that have colon cancer.
Well,
how do other countries compare? Or is it our diet? Or, I mean, even if you're not heavy, I mean, are we eating the wrong things? And it's
we do find a lot less colon cancer in the Mediterranean countries and in the Asian countries where
less incidence of it.
Yeah. There's less McDonald's and more fish.
Right.
Right. I think while there are some vegetarian vegans who would get colon cancer, I think your odds are a bit higher if you eat a lot of red meat, and generally the things that are bad for you, for your heart, are generally bad for a lot of parts of your body.
All right, Bob wants to know, how can I find out who does the virtual method in the Phoenix area?
American College of Radiology.
I was going to say probably the American College of Radiology, acr.org. American College of Radiology, based in Reston, Virginia, would probably be able to direct him. There is...
now, why do radiologists do this but not GIs?
Because it's a CT scan, it's a CAT scan, and radiologists are trained in imaging and such as CAT scans, so that's where it originated. It was actually invented by Dr. David Vining, who's a radiologist, now at MD Anderson in Houston.
So you, as a radiologist, would do the exam, do the virtual exam, but you're not going to go in there and perform surgery on someone if they have an issue?
No, I'm going to do the imaging.
Refer them?
And refer them to, at that point, a gastroenterologist if they need to have a colonoscopy, let's say, to remove a polyp. And like I said, about 1 out of 10 people need that. 9 out of 10 can walk out of the office and fine.
I think you made a wise career move.
We'll see after President Obama finishes up with his health care reform.
I'm just saying, like, if I was going to pick between the two, I would want to just perform the test where you don't actually go in anywhere and then hand the person off.
Well, there are advantages and disadvantages, and I think it's only fair that we discuss those. The advantages of virtual colonoscopy are that you don't get to put to sleep. Now, you were very brave and stayed awake, but most people in this country...
Oh, I didn't want to be awake. That's a whole other story.
Okay, well...
I wanted to be knocked out.
Why don't we switch seats and you can tell me about it, right?
I wanted to be knocked out, and I wasn't, and I thought I was going to be, and then the guy's like, well, you're not you're not cleaned out all the way. You're going to have to come back. And he's like giving me a hard time about it. I'm like, but I drank all that stuff. I mean, I did what you told me to do. Why are you yelling? Like, he was almost like he was mad at me.
Yeah, well,
like, dude, I did what how do I know if I'm cleaned out or not? I stopped eating when I was supposed to stop eating. I drank all that stuff, and I guess I just have a lot of, in me. I'm full of it. So I didn't get rid of it all. All right, there's a lot of easy jokes there. Pedro says that I'm glad to know virtual colonoscopy has been around for years. Too bad nobody told you before. You've literally been shafted.
True.
Yet on the other, but you're going back so often because your dad had colon cancer and because apparently they're finding polyps on you, correct? And they're removing them?
No, I'm not going to go into any details about my...
For you, if you were finding polyps,
yeah,
you probably should get a standard colonoscopy because you're going to continue to have polyps and you're going to have them removed. And the doctor could disagree with me if I'm wrong, but I would, if it were me, I would say he should have a standard colonoscopy if he's got recurring polyps every couple years.
But wouldn't the virtual test show the polyps?
Well, here's what I would say. I would agree, Andrew. The conventional wisdom is that, yes, you've had a family history of colon cancer, you're at a high-risk group. Let's presume that, let's forget about you, Rick, and let's talk about somebody who...
Well, no, because the difference would be that if you're with a doctor, a GI, a gastro, whatever...
Gastroenterologist.
Thank you. Instead of the radiologist, then when they're in there looking, if they see it, they can take care of it right then and there.
That's correct.
So you don't have to go through this twice.
And that's why the conventional wisdom is somebody who's had a history of polyps should have conventional, what we call optical colonoscopy. Optical meaning using a light instead of a CT scanner. But here's the downside to that. And here's where why I don't disagree, but that's why I say at least once in that person's screening history, screening life, they should get one virtual colonoscopy. And the study from the Annals of Internal Medicine had confirmed to me what I and many other doctors already knew. I have a internist. I work in the Washington, D.C. area, right down in downtown Washington, D.C. And I have lots of doctors who send me patients, and one of the reasons that they've come around to getting their patients involved with this technology is because all of them have seen patients who've had a colonoscopy within the last 6 months or 2 years show up with colon cancer. Big, pretty good-sized colon cancers.
Really?
Well, 6 months or 2 years ago, they were there, but they didn't get seen, probably on the right side of the colon. So we know that I like to think of optical colonoscopy and the virtual colonoscopy as being complementary. It's not a war. It's not like mine's better than yours. That's silly. What we care about in medicine, I think most doctors feel this way, is you want to do the right thing for the patient.
Yeah.
I do, and I think most doctors do, and I don't think that's the minority. I think that's the vast majority. We want to do the right thing. What the right thing is sometimes isn't so clear. So in this case, I would say as time evolves and we get more exposure, I think we'll find that people will come around to the idea that getting at least one virtual colonoscopy at some point in your screening history, whether you're high risk or low risk, is going to be a good idea. Because it's going to show things that aren't seen on the optical colonoscopy.
Well, what else would you say? You're a radiologist.
No, but honestly, I don't know any. This is very interesting. I teach the course. I'm one of the teachers, instructors for the course of the American College of Radiology. We teach other radiologists around the country. They fly in from all 50 states to learn how to do this, and it's a 2-day course. It's very intense. They spend about 12 hours a day, and when they're done, if they pass their test, they get certified. It is very difficult for us to recruit radiologists to do this. Why? Because they're difficult. You have to actually pay attention. They take time. They're not the easiest test to interpret.
Yeah.
You don't have to be a genius to do it. You just have to be willing to make the commitment to do it.
Okay.
And nobody's going to get rich doing virtual colonoscopies. So, it's very hard for me to sit here and say what I'm telling you is the truth, and I don't have any self-interest. The self-interest is that I do enjoy doing them, and I think it's a good test.
Yeah.
But if a gastroenterologist wants to do a colonoscopy on somebody, I have no objection to that at all.
Jan has a question. Can this test be used to look at the liver for people with liver disorders such as hepatitis C?
Okay, well, the answer to that question is CT scans can be used to look at the liver in patients with hepatitis C. People with hepatitis C have an increased risk of, among other things, cirrhosis and hepatocellular carcinoma, cancer of the liver. But a virtual colonoscopy, one of the things we do is we use a very low radiation dose. Because if you're going to have several of these over the course of your lifetime, we like to keep the radiation dose as low as possible.
Yeah.
So we literally crank down the dose to do this, because the colon is filled with air. You don't need a lot of x-rays to get through air. So we can really lower the dose. That's very good for keeping the dose down, and it's fine for seeing the colon. But the liver, to see the liver well, you got to have a much higher dose. So I wouldn't substitute a virtual colonoscopy for a detailed evaluation